This is Sarnia Lambton Daily for Tuesday, March 24th. Good evening, I'm Terry Doyle. Some news to pass along tonight. First of all, that the Doug Ford government has decided to suspend time-of-use rates for the province of Ontario for electricity. Now, all rates will be at the off-peak time 24/7. That's the rate you would normally pay on evenings and weekends, but instead it will be continuing there for the next 45 days. Something to keep in mind, of course, for people that are staying at home, which most people are right now, and kids at home from school. But conservation methods are still being encouraged in terms of not wasting electricity, but at the same time knowing it is a savings. Meantime, Sarnia City Council will meet on Wednesday to discuss some of their plans and some financial relief. Among them, waiving all bus fees until the end of May for Sarnia Transit. That has already been done, but not officially approved by Council in terms of suspending the bus fares, but now looking to put that in until the end of May. Sarnia City Council also expected to approve a measure to waive any fees when it comes to late property taxes over the next couple of months as well. All this will be discussed at Sarnia City Council at their Wednesday meeting, where city councilors will call in to the virtual meeting. We will have coverage of it right here on your TV Wednesday beginning at 10:30. Joined now by Dr. Michel Haddad, Chief of Staff at Bluewater Health, who joins us now from the Sarnia campus. And Dr. Haddad, first of all, we know it's certainly a very busy time in the healthcare field. We appreciate the couple minutes. How are things over at Bluewater Health right now on this Tuesday?
Terry, so far so good. We're all ready for whatever could happen. We've spent the last couple of weeks preparing. We have worked very diligently with all the hospital staff, both the nursing, medical, and support staff, supply chain, etc., to ensure that we have enough capacity to deal with any patient volume we might have. But so far it's been on the quieter side. So we'll see.
And I guess that's the thing. Quiet is good right now, but I would think preparation, that's the main thing. And it's certainly in your field. Preparation goes on all the time, but I'm sure right now preparing for what might happen here in Sarnia Lambton.
Correct. We're always ready, but we had to obviously activate our pandemic planning, which was developed back in 2002 with the SARS epidemic, and basically engage all the different teams, infection control, etc., to make sure that we have enough supplies and staffing, look at our capacity, and have what we call pandemic planning, sort of activating what we call a code orange, and go through simulated exercises, assuming that we have a massive onslaught of patients coming in. Hopefully we don't see it, but we're ready just in case. We always have to have plan A and B and C.
Are you finding too that you're able to learn from what you're hearing in other communities, what they've dealt with, whether across Ontario, for example, to help maybe even adjust in that preparation a little bit?
Absolutely. We keep learning from everyone else, all the way from China to Italy, Spain, the U.S., and and other hospitals in Ontario and Canada. Definitely.
So the question would be, of course, we expect the medical officer of health has said, let's, no positive tests have come back, but at this point, sort of act as though, as the average person, act as though it's in the community when it comes to social distancing. But what about the hospital? What happens if a patient comes in with suspected COVID-19? So
the hospital is set up to deal with all kinds of infectious agents, right? So we deal with influenza. Sometimes we have patients with TB. So COVID-19 is another virus that we have to deal with. So when someone comes in with a suspicion of being positive for COVID-19, for example, then we have mechanisms within the ER and the rest of the hospital to ensure that the patient and the staff is safe. We have certain protocols to have, for example, masks and gowns and gloves, etc. They're still patients. We have to help them, and as long as we follow our what we call PPE, which is personal protective equipment protocol, then we should be fine. And we're well trained in the use of those equipments, and we have isolation rooms, we have negative pressure rooms, we have so to ensure that there's no risk to other patients or staff.
What would be your message to the community? How can the community, be involved, be aware of obviously what's going on in terms of when it relates to Bluewater Health?
Well, the community is essential, actually. What happens out there is essential. As I have always told my colleagues and friends, the hospital is the last line of defense. The way to mitigate and beat this virus is with action of the community members themselves. So you want to reduce the transfer from person to person. The virus on its own can survive more than a few hours, maximum few days. So it needs a host, the host being human. So we are the ones who carry it. If we can disengage and keep that separation, so the virus can't jump between us, right? So that is the main and first line of defense. So that's why there's been a lot of talk about the so-called social distancing. I'd rather say physical distancing, because it doesn't mean social isolation. We're lucky that we have all this technology now, so you can talk to your family and friends, grandparents, kids with FaceTime and phone, et cetera, et cetera. So you shouldn't be isolating yourself, but at least physically distant. So, and the reason why we talk about the 6 feet or 2 meters distance is because droplets don't travel usually past that if someone coughs or sneezes. And this virus so happened to be contained in droplets. And as long as we can prevent that transmission, it'll die out and eventually disappear, which is what happened in 2002 and 2003 with SARS and H1N1 back in 2009. So the community is the main defense. And the hospital is basically the last line of defense. If all fails and someone gets really ill and needs to be admitted, then we're ready. We're ready to deal with whatever happens.
Is the key right now, too, because we see unfortunately, sometimes people will come to the hospital for other things. Is it more, I think one of the messages I saw was, reach out to your family physician, reach out to the online screening, go through other processes, don't just show up at the ER.
Correct. So the coronavirus, in this case, COVID-19, it belongs to a family of viruses. All coronaviruses is a whole bunch of them. So common cold being 20% of common cold is a different kind of coronavirus, for example. So not every time you have a virus or a cold, for example, you need to come to the ER, right? So the message is, if you have respiratory illness symptoms, stay at home, isolate yourself, and protect your family and friends. Now, come to the hospital if you're sick enough that, for example, you can't breathe. So common sense, and you have to come to the ER. Then we'll have then you need to come in and we'll treat you. Otherwise, 85% of patients who end up contracting this virus would usually get better on their own. Especially if they're younger. Somehow our immune system at the younger age seems to be able to fight it better. Having said this, there has been some cases of younger patients also contracting the virus. It seems to be more in patients who have immunocompromised states, for example, or other illnesses. Having said this, the population at risk, as you've heard, I'm sure by now, is patients above 7 years of age. So we have to really do our best to protect our seniors at their homes or long-term care homes. And the sad thing is that we are the younger people are the ones who are actually harboring the virus, and we have to make sure that our seniors don't get it. So it's our job to stop the spread of the virus and protect them.
Finally, before we let you go, how's the staff holding up there?
The staff is remarkable, actually. We've done a lot of mock exercises and preparations for this. Of course, people have a lot of questions, and that's very legitimate. It's in the news. We are the front line here in the hospital. If someone is really ill, needs to be admitted. But everyone is ready, and we'll continue to address whatever concerns or questions they have on a daily basis. There's some anxieties every now and then, but we are basically trained to do this, and this is why we're here, and why we went to this field, whether it's nursing or medicine or respiratory therapy, etc. So the hospital has a lot of different areas of specialty that is geared up to help our community. So and every single person is very valuable. So our facility staff is ensuring that everything is clean at the hospital, so we reduce infection transmissions. We have our nursing staff and medical staff is prepared to deal with any patient who is ill enough to be in the hospital or might end up on a ventilator or life support, for example. Our pharmacy staff is very prepared with the potential antibiotics or medications that we need to treat them. Our respiratory therapy staff is very prepared to deal with the patients if they need a ventilator, for example. Our ED staff is prepared for it. Our ICU staff is prepared for it. Our medical floors. Our surgical teams have been extremely helpful in ramping down, reducing the volume at the hospital by canceling non-life-threatening elective cases. and that has helped us in many different ways. One is to reduce the foot traffic at the hospital, so increase the social distancing that we talked about, as well as free up resources in case we have a surge of patients, so we have more supplies, more masks, more gowns, more gloves, etc., etc. So everybody's done their part. Everyone everyone want to help out, and I'm relying mostly on the community now to stop the spread and reduce the burden on the hospital. But if we have someone, rest assured, if someone is sick, rest assured that the hospital is ready to help.
Well, Dr. Haddad, we appreciate you joining us. We definitely want to pass that message along to everyone watching us, and keep up the great work there at Bluewater Health.
Thank you so much, and thank you, Sarnia Lambton, for your support and help with this. I know we can beat it together.
So. Absolutely. Thank you, and stay safe. That's Dr. Mike Haddad from Bluewater Health joining us. More Sarnia Lambton Daily to come on your TV. Welcome back to Sarnia Lambton Daily here on your TV. Throughout the show, we're going to be catching up with various municipal leaders throughout Sarnia and Lambton County. And without further ado, let's bring in Warden Bill Weber, who joins us now from Lambton Shores. And Bill, I'm sure a very busy time right now. We talked to Mayor Mike Bradley yesterday on the show. We want to get more of a county perspective as well. How are things going right now in and around Lambton County?
Well, first of all, I want to thank you for the opportunity to talk with you and share a message with residents. Things are going challenging, I guess. It is unprecedented times. Everyone is working hard together to make sure that we communicate properly and keep everybody safe.
And I guess as you go through this is something that I know you go through preparations for, but still now living it, I have to think you have to be very appreciative of the cooperation that everyone put in to those preparations, because now we are in it.
Yes, you go through training with the emergency plan, you have lists of things and every different scenario. But when you get actually into something like this, that is, again, it's brand new, for the vast scope of this, that yeah, there's things that you have to, it's on the fly, and changes come daily.
What do you find right now are some of the biggest challenges that at a municipal level you're dealing with right now?
I guess it's how we keep businesses going, how we keep communicating. Getting the message out to those. Not everyone has internet. There's social media, certainly getting the message to a lot of people, but not a lot of people, or not everybody has that. So that's something that we work on, and I hope that lots of people watch this show and we'll get some information from it.
Do you find too, as you talk to just the average person, is it sort of that real adjustment that people have their routines, and now having to adjust to a whole different day-to-day life right now just causes that extra level of stress?
It certainly does. People don't know how to react, and I guess we talked of social isolation, and the main concern, I guess, is people coming from international travel from the U.S. and abroad, and coming back, and that word is there, social isolation, but what does it really mean? And I guess I would say that the Prime Minister said it best yesterday. It means go home, don't go to the grocery store, and stay home. Get someone to get your groceries and what things that you need. We have to isolate. It's really the main message that we have to get there. And our communities across the county, there's so many people that are willing to help, willing to pick up your groceries. They don't have to isolate because they haven't been out of the country. So there's so many people that are doing that, putting them on your doorstep. There's a protocol for that. The Lambton Public Health has some protocols, and I'm sure you can put those websites up on the screen for us. Would be appreciated, so that those protocols happen, that the volunteers are safe while they're doing that. We have a vulnerable society, and I think the elderly and those with immune issues need to be protected.
Yeah, I spoke to a gentleman today who I know is in his 80s, and he had someone ask him, hey, do you need any groceries? Do you need anything picked up? So it's great to see neighbors helping neighbors and people in the community definitely chipping in and staying safe at the same time. Bill, what's a regular day? Of course, I use the term regular very loosely. What goes on day to day right now in terms of your schedule as you communicate with some of your partners both in Lambton Shores and around the county?
Well, kind of the new normal for me in the last week and a little bit has been either a meeting at the county. We do a video conferencing. I either go to the county or I do it from home here at my kitchen table with all the mayors and CAOs of all the municipalities. We go over what's happened. We get an update from Dr. Renaday and any updates that are possible. We talk about what the province and the federal government are doing. And then we have a meeting with the control group, the Lambton County Control Group, talk about issues and how we're going to do messaging, go through that process. And then after lunch, I have a meeting with the Lambton Shores Control Group and what we can do and how we can maintain everyone's safety and health of our staff, as well as the residents of Lambton Shores. So it's a busy day. Sometimes it feels a little bit like the movie Groundhog Day, that you get up and you do the same thing again. But each day we do come up with items that need to be addressed, and everyone is pitching in. Everybody is working towards a solution to this, and how long it will go on, nobody really knows yet, but we're committed to making sure that we get through this.
I was speaking to someone with another municipality over the last 24 hours as well, and it sounds like there are certain things you took for granted that think, wait a minute, how do we do this now without face-to-face communication? And then on the other side, there are those things that come up to say, ooh, we better put a stop to that right now to keep everybody safe. And I'm sure as you go through those conference calls, those things come up where it's like, oh yeah, I guess we better take care of that one. And then of course, later in the day, actions are taken. But I've got to think, as you said, every day something new comes along.
Yes, it does. And the things that are concerning, I guess, are the people that aren't really taking this as serious as they should. It's been beautiful weather over the weekend, and up our way, we've had a number of people out on the beach and just being outside, which is great. But they're not keeping the distance from other groups. You see groups gathered, and that's concerning, because everybody is aware that they're supposed to, and I guess it's hard to get that message out. Playgrounds are one of the things we've talked of several times. There is a protocol. Some places are closing their playgrounds. Other places are, going through the hand washing and take the precautions that you should, social distancing on the playgrounds. But so those are the things that we want to really stress that need to happen so that we can get through this quicker.
So you've got the floor here, as you've had for the last 7 minutes or so. If we just said, hey, people watching right now, Warden Bill Weber, what do you want to tell them?
I think the message is stay home, stay separated. Those that come from a trip really must go home and stay there, get somebody to help you. It's a bit of a broken record, but not everybody's hearing it. So that's the message. Follow what the Lambton Public Health website has on how to maintain your social distancing, how to look after yourself, and be safe. Be a good neighbor. There's a lot of good things happening out there going through this process.
Well, Lambton County Warden Bill Weber joining us here. Bill, we appreciate your time, and certainly great job everyone that's doing. I know it's difficult times, but everyone stay safe, and we appreciate you joining us. We'll catch up with you again soon.
Thank you very much.
There's Lambton County Warden Bill Weber joining us here. Stay tuned. You're watching Sarnia Lambton Daily on your TV. Finally tonight here on Sarnia Lambton Daily, one of the most difficult things to deal with right now is how to talk to children about what's going on with this pandemic. We caught up with a counselor with some ideas to pass along.
Well, I think what's most important in all of this is understanding the age category. So for our kindergarten children, are basically our pre-grade 1 children, primarily it's more about parents paying attention to their own mental health and to their own behavior, because children that are high level of linguistic ability understand their world through the adults that surround them. So the behavior of the adults around them is how they determine their own behavior. So the more anxious we are, the more disruptive things seem to the children around us, in particular young children. That is how they determine whether there's a problem or not, because their linguistics aren't quite there to understand. We can use terminology of, it's a bad bug, it's a nasty bug that likes to travel around. They can get some basic understanding on that, but primarily the way in which they're understanding the nature of this problem is through the adults that surround them. So the more calm that we stay, and in particular, the more that we stick to normal routines, sticking to breakfast when breakfast is normally served, having nap time when it's normally nap time, doing things as normally as possible is how we manage the anxiety that may be transferred or maybe, perceived by the kids that we're taking care of. The teens really don't quite understand this, but just in a slightly different way, in that they're not highly impacted by it. If they have a job, if they're a teenager where they do have a job, perhaps they've been asked to stay home, and they might understand that some of the gravity of that. For most of the teens that don't have jobs or work, there really isn't yet any real significant impact for them. So it's trying to reinforce to them staying clean, washing their hands. But again, they do still feed off the perception of what they see their parents going through. So the calmer we stay, really the better. The challenge where we're going to see some mental health difficulties or differences is really in that middle range. So they're not fully teenagers yet. They're not kindergarten or even grade school. They're right in that middle school area, and they will see significant impact, just in the sense that the programs that they might have been involved in, if they were doing day camp or if they were doing things of that kind, and obviously they can't go back to school, they will see probably the most amount of disruption. So for them, it is having a semi-adult conversation of we're okay, everybody really is okay. Obviously not those that are vulnerable, but that reassurance is important. Trying to keep them busy, give them household tasks, give them things that they can be proactive in trying to be part of the solution. This is always a good thing for children, to give them the ability and reinforce to them that, even if you give them a task of cleaning their bathroom, that was helpful.
Certainly some things to keep in mind when it comes to dealing with children during the pandemic. Well, that's going to do it for Sarnia Lambton Daily for this Tuesday, March 24th. We are with you every weekday at 6 o'clock here on Your TV, or you can check us out on our website at yourtv.tv beginning at 7 o'clock. Same time you can see us on our Facebook page at Your TV Sarnia. For everyone here at Your TV, I'm Terry Doyle. You've been watching Sarnia Lambton Daily.